controversy. Nip Tuck is an original dramatic series which peers into the world of plastic surgery. The show focuses on the complexities of patients who try to accommodate their psychological needs through cosmetic enhancements. And joining us now to dispel some of the myths surrounding plastic surgery is Dr. Mukhtar Asaadi, a board-certified plastic surgeon from New Jersey. Hi, Dr. Asaadi.
Good morning.
Good morning to you. Well, we see the words cosmetic surgeon cropping up all over the place. What's the difference between a cosmetic surgeon and a board-certified plastic surgeon? Is there a difference?
Yes.
Okay, what should we be watching for then when choosing a plastic surgeon?
Well, cosmetic surgery can be done by any person. Can be a plastic surgeon, can be any kind of a specialty. So it's a broad name. Plastic surgery can be done by any kind of the person or any kind of the background of the medicine. But in order to become board-certified plastic surgeon, you have to go through the certain credential and education in order to pass the test to get board certification, and also you have to have a certain criteria on how you are going to practice.
So what should I be asking? Are you board certified, or will I see something after your name that tells me you're board certified?
You have to be sure that you ask them they are board certified plastic surgeon.
Okay.
Because they will say, well, I'm a plastic surgeon and I'm also have a credential to doing the procedure for you. Board certification by the American Society of the Plastic Surgeon, by American Board of Plastic Surgery, means that you have to at least have certain amount of the years of the training in general surgery or otolaryngologist background. You have to, most of the plastic surgeons these days are board certified general surgeon at the beginning. Mm-hmm. Then they have a training in plastic surgery, usually 2 or 3 years. Sometimes you go through the combined procedure of the general and plastic surgery, which takes about 6 years. And many of them also go through fellowship, which is extra training. So really they are qualified to perform the cosmetic procedure for you.
Do you find yourself having to fix some of the problems that have arisen from people going to just cosmetic surgeons?
Well, I do not want to label that anybody who's doing cosmetic surgery, if it's not plastic surgery, is not going to do the good job for you. Mm-hmm. That's not my point. Is that what you have to know, that the person has all the credential and education and the background to perform the procedure for you. If you want to, the cosmetic surgery is not nip and tuck. The Botox party should go out of the way. There is no Botox party. I'm going to go line up 20 people in a spa and start injecting them. Any procedure should be taken seriously.
Have you heard about the show Nip Tuck? Have you?
I heard about it, and I heard that they are degrading the value of the plastic surgeon and also the standard that we are trying to keep for our society, American Society of the Plastic Surgeon. Because cosmetic surgery is a serious surgery. You have to go to the qualified person in a safe environment to get a good result. Don't take it lightly, and it's not just something that I'm going to go for the lunch break, have my nose done. That doesn't work.
No. I mean, first of all, a good plastic surgeon will insist upon a consultation before anything is done, right?
Absolutely.
And have a good chat back and forth with the patient. I know, I speak from experience.
Well, consultation, most of the plastic surgeons at least see the patient twice before surgery. You want to answer all the questions before surgery. If there is any question they ask you after surgery, it's too late.
Right.
If you don't want to get a phone call after surgery and ask you why this happened to me, because you have not spent time with them before surgery. What
about getting recommendations from former patients? Can you ask the surgeon to get references?
Absolutely. First of all, 80% probably are our patients that come to us because of the referral from the patients, previous patients. The patients are smart today. They are very intelligent today. They know about the procedure. They have seen other people. They use the internet. They read about this procedure. They come to you. So they are well informed. So you don't see somebody who's just coming. As a general rule, I'm just making an example. I don't want to see the patient coming to me from Yellow Pages, that they just pick me up from the Yellow Page and come to me. I have no idea who I am, what I do. So your patient referral is very important. Most of them, they had the friends done, the families done. You have taken care of them for many years. They come to you for something else. Also, you have to be sure that you are affiliated with the good, accredited, well-established hospital or institution. If you can do that procedure in that institution, it means that you have a credential to do this procedure for the patient.
And would you recommend patients look for plastic surgeons who have, say, specialty areas, like a facial plastic surgeon or a hand plastic surgeon, rather than the full body plastic surgeon?
No, that doesn't work.
No?
If you are good in facelift, doesn't mean that you cannot do the good breast augmentation or
Right.
liposuction.
Okay.
I mean, you might be able just limiting your practice to liposuction. And sometimes you're perfectly right. My patient comes and says, I have done the, let's say, breast operation on them for many times. They ask me, after many years, I didn't know that you do the face too. It means that you are not informing them enough.
Right.
But if you are good in something, it doesn't mean that you cannot do any procedure safely for them in the best way that you can do.
Open dialogue.
The technique is not important what you do. You have to evaluate the person and find out what's going to work for them.
And feel comfortable with the doctor. If you don't feel comfortable on a personal level, I don't think that's a good match.
We call it pattern recognition, meaning that the minute you talk to the person after the first 20 seconds, you know whether this patient is right for you.
Right.
And the plastic surgery patient is very demanding, and they are going to have elective surgery done. You have to sit down and explain everything for them. After half an hour conversation, they become comfortable, and you know that they are going to get what they want.
Right.
And they have to have a realistic expectation.
That's right, too. You're not going to walk out of there looking like a supermodel.
That's right.
Even though you might want to.
That's right.
Realistic expectations. Very good. Dr. Asaadi, thank you very much for joining us. And if you'd like to find a board-certified plastic surgeon in your area, go to 888-4-PLASTIC. That's www.plasticsurgery.org, or call the American Society of Plastic Surgeons at 888